Sisters, the island that Store Sisters.
So Facebook. Okay, cool. Looks like we're on there. And hello, everyone. Everybody out there, anybody out there. All right. Okay. So when you do live, it's a little different, right? Because you have to make sure everything's good to go. But it looks good. If we were not live, I mean, we could edit and we could do a lot of things to it. But we have one person on. I don't know who that is, but so
My mother.
hello, guys. Welcome to our 4th episode of the Agave Hour podcast. I am your gracious host, Israel Silva. You guys are witnessing again the 4th of what we hope our many podcasts will be streaming. We're good. Live here from Agave Studios. Let me say now that if you enjoy what you are seeing, please like, subscribe, and share. This will help us gain some traction and grow our audience a little bit faster. Podcast is currently being streamed live on Facebook, Instagram, and the Agave Hour podcast channel, which is on YouTube. So that's where you guys want to go and like, subscribe, and share. It's growing little by little, so we've had some good guests already. We're hoping to get some more, of course. The general theme of the Agave Hour podcast is to bring to light many of the wonderful people of the 956. Guys, again, if you guys are out there and you can hear me, you want to comment on something, especially how we sound, you guys know that we've had a few issues in the past. I'm hoping we corrected all that already. But yeah, let us know. We'll make adjustments as we have to. But yeah, we want to bring to light many of the wonderful people here of the 956, whether they're entrepreneurs, educators, philanthropists, artists, sports figures, actors, authors, politicians, and heroes of all types. I know that I've gotten some calls from some people that are running for office here in the next few months, or next year really, but next few months as well. But if you know anyone out there that has an interesting story, please let us know. Send us a message, their contact info, or feel free to pass our info on to them. One of the reasons we want to do this live is so that we can basically have a Q&A with our guests. But we also not only want me to ask the questions, but we want you guys to chime in. If there's something that interests you, you want to know, please ask. Of course, we want to keep it clean, want to keep it professional, without any gotcha moments to our guests, but we primarily want to make it fun, friendly, as if we're having a casual conversation with not just our guests, but with our audience as well. Of course, I'm reading some of this, guys, because I don't have it all memorized yet. Additional to our local guests will also be, we will also be bringing on some people at a national level, and there'll be different people from industries like the arts, addiction, HR, education, comedy, the environment, food marketing, and so on and so forth. So stay tuned to some of our upcoming podcasts. So one of the other things that I've been wanting to do, we just haven't had time, is talk about dating in the 956. We've had many conversations with many people, but I think honestly that we might have to just do a different show, a different time. Maybe Fridays, Saturdays, call it 956 After Dark, or the Agave Hour After Dark, something like that. But anyway, that's something that we'll be doing in the future. So we'll let you guys know. So pour a glass, pull up a chair as we take you to some of the unknown. Today's guests are Marisa Gonzalez and Lorena Hernandez, who are the founders of the Texas Healthcare Alliance Chamber of Commerce. I'm going to read to you guys a little bit about what they do. The Texas Healthcare Alliance Chamber of Commerce aims to be an education resource platform to empower the people of our community to actively manage their health with resources available through its members. they will have an opportunity to access the website, follow them on social media platforms to become informed on some of the services that are available to you guys. Additional services will include Living Healthy, segments from THACC members during lunch and learn segments. It says additionally participation in the 5K walk with the doc fundraising event, community health fairs, just to name a few. There's some more stuff, but we'll talk a little bit about that. So Lorena and Marisa, welcome to the show.
Thank you for having us.
Thank you.
Absolutely.
Hello, everyone.
Absolutely. So this alliance, this Chamber of Commerce is fairly new, right?
It is.
How long has it been around?
So we launched in mid-April is when we became live to accept memberships into our chamber.
6 months now.
6 months.
6 months.
Yeah.
Yes.
There you go.
That's good.
Yep.
And you membership wise, how are you doing?
So we have about 45 members now. It keeps growing daily. I mean, we get calls just about every day. You know, one new member a day at least. You know, we're
That's
hoping to
good.
grow it faster than that. But
That's good. That's good.
you know, this is something that we do separate from our everyday jobs. So
We're growing
That's really,
slow
really,
and
really
steady.
good.
I think
Yeah.
that's the way we want to do it also. Just we don't want to expand too fast either.
right.
Right. So I wrote down some questions, of course. So, you know, because this being a new type of chamber, we don't have that here. Is there anyone like it in the state of Texas or?
In the state of Texas, there is just not anywhere south of maybe Houston.
Yes.
Yeah,
Okay.
that's what we came to find out. Maybe even Dallas, I think, further up. So no, south of Dallas, no,
Nada.
no.
So I know that you guys have known each other for some time, but what was the driving force behind the chamber? Why did you guys decide that you wanted to take this approach?
Well, we both work in healthcare, and I'm not a clinician, meaning I am not a nurse or a doctor or anything of the sort. I pretty much have been involved with a lot of physicians, working for them on an individual basis and helping grow their network.
Mm-hmm.
So basically, that's what I've done for 18 plus years,
18 plus years.
working
Yes.
directly, you know, with physicians one on one.
And you and I, we've been around this field for a long time. So I've known you for a long time. And yeah, you definitely do have a big, I don't want to say following, but you have a lot of people recognize you and they know you that you kind of connect the dots and help a lot of people out.
Yes, in the healthcare community, yes, that is so, and it's only because I have been on the other end of the spectrum. I have been on the side where my daughter needed the healthcare need and received the services at different capacities throughout her 27 years of life, and so it was very important to me to be able to portray that to the physicians to say, hey, you know, patient care is very important. Getting to know them on a personal level is
Right.
very important. That used to be the practicing way years ago, back in, you know, when I was a child. I truly recall being patients of a local physician, you know, who doesn't exist anymore. But nevertheless, the care was different. You could pick up the phone, you could call them, you could communicate whatever it was that was going on with you to them, and they were readily available to you. Of course, things have changed now. You know, there is so many physicians here in the area now. We are saturated with different, not only primary care, but specialties. Whereas before, we didn't have any specialty care physicians. We had to
didn't.
seek
We
health
really
care
didn't.
outside of the Rio Grande Valley to get that. But here we are now. We've got it all here.
Yes, and I'm
That's
actually
good.
a nurse.
Yes.
I've been
Yes,
a
I was
nurse.
about to ask you what
Yes.
what role do you have and how long have you been a nurse? Because we've talked we met not too long ago.
Yes.
I know you have an extensive background in nursing, but how did you get involved with this?
So actually, I've been a nurse for 26 years, I want to say, but I've been working in the medical field for many years now. I am a wound care certified nurse, been certified for 20 years, and I have a passion just to make a difference in the patient's life. So when we were given this opportunity to make a difference, I really want to be there for the community. I believe in paying it forward, and this is my way of paying it forward. It takes a village to make a difference, to raise a child. Well, it takes a village to make a change. And I saw this opportunity of bringing this chamber to make that change in the community.
Very, very cool. So how did you guys meet? How long have y'all known each other? I know both of you guys are hustlers for sure. You have you know a lot of people.
Well, she being in healthcare, in the clinical aspect, and I being in healthcare on the network development sector. Do you want to go?
Paths.
Actually, we cross paths on social media. We follow each other and what we do in our professions, and we like each other's stuff, and we love each other's stuff, and we comment on our posts.
Yes, and we actually did cross paths in some events. So there was an opportunity. Actually, I reached out to her last year, 2 years ago. Yes. Saying, hey, you know what? I've been approached about bringing some education and awareness to the community for wound care.
Okay.
And I was thinking of putting a symposium together, but I have a full-time job, and I know that you have the ins and outs here. I would love for you to be the base and then help me from there. And time went by, and we
continued working our full-time jobs. So that thought just kind of like it stayed there, as an idea. And then I thought, because I work for I'm a contract employee, so I pretty much contract myself out to different doctors and different specialties. And so I recognized I can only, spread myself so thin as far as service rising. It's the same network of physicians that I've worked with for many years. And the chamber idea came to surface. I thought, there's different chambers of commerce throughout the cities. How about one for just healthcare specifically, where we can bring in a network of people that work in healthcare together, and they can network amongst each other, and nobody has to hire me for anything.
That's excellent.
And we started actually reaching out to our own connections first. That's why we're growing slow and steady, because who we reached out to the community first are our own connections that we have. And I think that's how we've been more successful in getting all these members coming in, because they know who we are.
Right.
Yeah.
That's good. Yep. That's good. So some of the strengths, again, I know that I like from what our discussions, I mean, you guys, you're more clinical. She's not clinical, but I mean, you've learned a lot, right? And you're clinical, but you've been able to connect the dots a lot. So I like the camaraderie that you guys have, and I think it's good that you guys are putting this together, because I know, me being in the medical field as well, there is some sort of need. I mean, we are part of some of the chambers of commerce, local chambers of commerce, and they do a fantastic job.
They do, but
they're just not specific to medical. And me being in the field, there's a lot of things that we can do together if we just had someone that would, connect the dots like you guys are doing.
Right. So whenever we host our networking events, it's going to be people all in the same field who want to be in front of each other, and maybe they haven't had that one-on-one opportunity to do that. And through this alliance, you can do that. You can come and meet people that are in the same field as you, that you want to connect with, to offer your service to, and vice versa.
Yeah.
And they're able to understand their pain points. We know what you need because we also need it, but in a different level, but still in the same organization. To say networking, we understand that there's big changes coming in with all these new laws, and it's going to affect everybody. So we actually are trying to be proactive and trying to make a difference in the community, and networking with everybody that's having the same pain points. I believe is going to make a difference.
All of these changes affect not only the people in healthcare per se, hospitals, doctors' offices, and such, but the people who are
Yeah.
needing this service and are gonna get the service if they can, if they, we don't know.
And the medical community here has grown
Yes,
expeditiously or expeditiously, whatever. And it keeps growing.
Yes.
I read recently that there's another facility coming in. They're going to spend about $1 billion on 495 and McCall, something like that. It's a new hospital that's going to come in.
It is.
And we do need a lot of services here. We're one of the poorest counties in the whole U.S. So I think that's going to help. And the current facilities that are here, they're, they've gotten better, they've gotten bigger, they've gotten technology has really changed over the years. So that's amazing. That's a lot of research that we're starting to do here now. I see it every day. So I think you guys are doing a good thing because with the university here as well. You guys are going to be putting a lot of people together in touch. There's a lot of new physicians that come down, and they have some direction, pero they still need a lot of help.
Right.
in
And
many
and I
ways.
get that because I get the calls. As a matter of fact, I have one I'm meeting with this week, new to the area, and he heard my name, and here I am.
Yeah.
Okay, well, we can talk.
Well,
I mean,
Simon,
I want to be able to help everyone and anyone who needs, direction, who needs connection, who needs that network, that I have been blessed to have been connected with throughout the years. And it all has to do with the level of service.
Yes.
I highly, highly stress that. I love sharing my knowledge with people who are in the same field as I, but work for someone. I like to be able to share with them how I got to where I am, and it wasn't easy. It was just being dedicated, being there for them, meeting their needs. How can I help you? How can I make your job easier? And that's all.
so how long have you been in the medical field? Then
18
again?
years.
18 years.
Mhm.
Lorena, you've been in it for how long?
Well, actually, I started when I was 16.
Oh wow.
Yes.
So you've only been in it 2 years.
Yes.
Something like that.
Yes. Yes. I started with the gastroenterologist, Dr. Javier de la Garza. That's when I started working, and I started working there in the summers in his office. And from there, it just grew into other areas, but it's all been in the medical field.
That's awesome.
Yes.
So you guys met a couple years ago, and then Lorena, some of the strengths that you see in Marisa, same thing. What is it that said, what, she'd be a good partner to help create this new alliance?
Well, I know she goes 110 miles an hour. So do I.
She does. Yeah.
So
I think we call it Fast and Furious,
yes.
right?
I see a lot of things in Maritza that I see in myself also. We're both very driven. She's very mind professional. How should I say? She's very detailed oriented when it comes to certain things, and she has really blossomed our brand. She's makes sure that, hey, if we're going to market ourselves, we have to go here and here. And that's where, she takes the lead on that. I know she's very hardworking. We start off the morning real early. My phone, I'll get a text at 7:15. Hey, we have this going on today. And yes, we have a full-time job. So it's working, even during our lunch hour today, my daughter took me lunch. And after hours, look where we're at right now. So I know that she's well connected in the community, and she has a very high reputation. And that's who I wanted to associate myself with.
Sure.
Because I think that speaks mountains.
Yeah, it does.
It does.
And you're right. I've known Marisa for many years, and you hit it right on the money. And Marisa, what did you like about Lorena?
Well,
How did
Lorena,
that-
she's very smart, and she's everything I ever wanted to be, and that was a nurse. Unfortunately, I was not able to pursue that career because my obligation and dedication was primarily to my daughter, who required 24/7 care and had her own healthcare battles. So I couldn't do that, as much as I wanted to, but I admire that about her, that she was able to do that. And she is she's an overachiever. and that's a
Both
good
of
thing.
ours.
She's an overachiever. She has every certification you can think of that comes with wound care. And
That's
it's what
awesome.
XYZ, what ABC, XYZ, something like that. So yes, that's very impressive to me. And I thought, okay, well, I mean, this is, yeah, I want to be her friend. I want to be her partner. I want to be, and that's how, yeah, that's how I
Came
see her.
together.
Very smart. Yeah, very smart.
That's awesome.
Dedicated for sure. Um, I'm hoping that she'll take me one day, crossing my fingers. Can everybody see this?
Yeah.
That she'll take me on one of her trips to Panama or to, I don't know.
Puerto
They're not
Rico.
trips, they're work. It's actually
Work.
work. She works all over the place. But we'll see.
So one of the things
Mhm.
that you're doing, Lorena, is what specifically? But I also, a question that I had written down is so what was your first job in the medical field, and what are you doing today?
So I actually started off as a receptionist, and I worked for Dr. Javier Garza. I was still in high school, and by the time I graduated, I was working both of his clinics, one in Wessico and one in McAllen. And from there, I did work with the state facility in Harlingen,
Mhm.
and I was going to nursing school when I was there. And sadly, I actually had my mother there as a patient too, with tuberculosis.
Wow.
So yes,
With
and
TB. Wow.
yeah, and then after that, I graduated. I worked at McAllen Medical, and then I also did some agency work. So I used to cover all the hospitals wherever they needed me. And then I've I've always had a passion for wound care. Um, I know we talked about it when I was younger, 12 years old. My mom used to come home with sugar packets in her uniform, and I asked her, "Why are you carrying these sugar packets?" And she would tell me that they used to fill the ulcers with the sugar and then pack them with moist iodine, and that always stayed in the back of my head. So when I had the opportunity to take the certification, I did. My husband went ahead and I had to go away for a whole week to go do the education and training in Houston, and I did. And ever since then, I've always been very passionate when it comes to wound care.
So you've been doing wound care for how long?
I've been wound care certified for 20 years.
20 years.
Yes.
Damn.
And then, yeah.
So your current job takes you out of the area for
It
what
does.
reason?
For education and training. I work for an international global company, and I do education and training when it comes to wound care products that the company carries. And if it's rolling out in a different hospital or bringing in a new product, we do the training or just dinner programs. I do a lot of dinner presentations on the products that we carry.
And is this only here in the U.S. or does it take you?
So I do cover multiple states here. It's called the Gulf Coast Division, and then I also go into Panama and Puerto Rico. I haven't been to Puerto
Wow.
Rico in a while, but yes, to Panama. So, and it's like I say, it's if you have a wound here in the States, you're going to have the same wound in Canada or
Mhm.
anywhere, across the country. So, but I focus also what I can do here and make a difference here in the community because, believe it or not, we are dealing with a lot of issues here locally.
We sure are.
We have the highest rate in diabetes.
Diabetes, for
Absolutely.
We have
sure.
amputations, and I want to give back to my own community. And on my free time, this is what I do.
That's amazing. That's very, very interesting. I've met a lot of wound care physicians, and I know they get scrutinized a lot. I don't know if that's still happening, but I think what you guys are doing, it's amazing though. It really, really is.
Yeah, we can touch on that in just a little bit.
Yeah, for
Yeah,
sure.
we can elaborate
Yeah,
on that.
I did want to ask.
Mhm.
And Marisa, what was your first job? What
So,
got you into the medicine?
Well, what got me into medicine was, first of all, my journey with my daughter,
Right.
okay, and her healthcare battles. But my first job was working for Valley Eye Center. They're not called that anymore. But back then, Valley Eye Center was one of the largest eye centers in the Rio Grande Valley, and they saw up to 300 patients a day. Because I was not a clinician, I was hired though because of my passion to service people and make sure that they were taken care of when they went into this doctor's office, right? They had a high volume. So I remember applying for the job and I didn't have experience, right? Because I was a stay home mom with my children. Um, in healthcare, this is my first job. I had other jobs before, but not in healthcare.
Yeah.
And so, I remember this was a business that was administrated by Mr. Michael Laney and owned by Dr. Richard Berkowitz, very well-known ophthalmologist back in his time. And they had this theory of making sure that every patient's visit was pleasant because they saw so many patients a day. 300, that's a lot of patients coming through a clinic if you think about it. You know, they had 8 specialists in their practice, and my job was to oversee every department and identify where they could improve from check-in to check-out. You know, that was switchboard operators, that was the check-in process, the checkout process, the insurance verifications, you name it, whatever it took, and how long they waited in each waiting area, because they had 2 waiting areas. That's how large they were. And one of the highlights of that job was when we had a family come in with their son, 7 years old, who needed to have an enucleation. That was to remove his eye. They didn't speak English, so I was the translator, and I had to pretty much tell them this is what it is. This is what's going to happen. This is what we need to do next, right? Which was to set him up for surgery in the hospital. And I remember they spent a lot of time in the clinic that day because there were so many things that they needed to do to be able to come to the conclusion that they came to. And I felt so bad for the family being there. So I left, went to McDonald's, bought them food, brought it back, and fed them before they went into the hospital, because I thought, you know, I've been there. I know there's not going to be any time for this. So this is where I started to demonstrate my compassion, my empathy
No doubt.
for people on the other end, and made that known to every doctor in our clinic, to our staff members, that this is the way you need to see these patients, because you have no idea what they're battling. You have no idea what they're going through. Yep. You know, you have to be that pleasant voice. You have to be that helping hand. You have to be that compassionate person. So,
you have to be. I tell some of for years and years, I've always told some of our staff members that you just don't know what they're going through, and then they feel sick. They're gonna come to you, and then they have to pay you. You have to charge them, and they have to get these studies. They have to drink some stuff. They have to get some stuff injected, and you have to be compassionate.
And then the elderly, you may be their only conversation for the week. That was their only outing, was the doctor's office, and it was because they're not feeling well. And then to be treated less than, I mean, come on, you know. And this is something that I share with every physician that I have ever worked for. Don't let me down. Yeah. You be this person.
Wow, that's amazing. Very cool. So we have a question here from Lena. It says, how is the process to be a member?
Okay, so you can go onto our website. That's www.texashealthcarealliancecc.org, and that will take you to our application process.
Okay. What do your memberships start at? And I think I have something that
I think you might need to pull that up there. Another thing, you do have to be providing a healthcare related service to be able to join our chamber.
Okay.
That's the only stipulates that we have that we require.
So you have different tier levels.
Correct.
100, 150, 500, 1,000, 1,500. That's not bad.
No, that's for the whole year. So if you join September, you're not due again for next year, September. So yeah, so we have individual tiers, and that is for $100. We have nonprofit organizations. We offer $150, and we also offer our space for. Oh no, I'm sorry, not that one.
I was
sorry. I got ahead of myself. Then we have a small business. So small business is $500. That is a one business. You have one doctor's office, you have one dentist's office, whatever it is, you qualify for that $500 tier. But if you have a large business, meaning more than 2, then two or more, sorry, then that changes. That is $1,000. We do corporate levels. That's $1,500. That would be like your hospitals or anyone who has a large corporation, a large entity, like, you know, five or more. Yeah. So support
And then
groups.
students.
Support groups, we do not charge for support groups. We do offer our space, our office space, for them to come to and host or hold their support group sessions there at no charge. You know, we offer that space. And then we have students. So we have any healthcare students of any kind, they can join our membership for $25. They get to receive our newsletters, receive invitations to attend any of our events
Networking.
and networking events, receive a letter from the chamber for their volunteer services if they need to provide that for college resumes, things like that. Mm-hmm.
Excellent, excellent. We have another question here from Guillermo, but this one's this is more to me as a self-employed CPA. Where can we get reasonable insurance? I'll call you tomorrow on that one. It just so happens that I'm also an insurance broker, so
Yeah.
Yes.
just so that everybody knows.
If you sell health insurance,
Yes,
we can definitely have you on board.
Yeah,
can be a
yeah.
member.
That's
Oh,
that,
wait, you
that
already
is
signed
true.
up, right? Thank you.
I think so. I don't know. I need to check with my partner, but yes, for sure.
It's a done deal already.
It is.
Of
It is.
course.
That's what your partner said.
Yeah, for sure, for sure.
Yes.
Yeah, Guillermo, thank you for chiming in, and we'll be contacting you soon. We'll call you tomorrow.
Was that Jimmy Kimmel Guillermo?
No, that's another. That's another. Guillermo. That's another
We're
Guillermo.
already
I'm
hitting
just
that
kidding.
level. We're already hitting that level.
So currently you guys are, I guess I like to be positive. So you guys are close to 50 members,
Mhm.
right?
That's
Mhm.
right.
And as far as memberships, you can pretty much go as it's just endless, right?
Right.
The amount
Yes.
of members that can join.
Mhm.
So I know that you guys you guys were featured on the Concepto magazine
Yes.
not too long ago, and I read somewhere that you guys are going to be doing your first symposium.
Yes.
So tell us a little bit about the symposium. What do you do? How is where is it going to be? When is it going to be only physicians? Is it nurse practitioners, or what are the topics of the symposium?
I'll let Lorena talk about that. That is her field of expertise, and this is something that she put together. So we're really, really excited about it, and we actually just closed it off today because we're at capacity. But go ahead,
We
talk
are.
about it. I'll go ahead and mention all our panel.
That's the best part. We
Yes,
are sold
yes,
out.
yes.
So it is the Wound Care Symposium. We are going to have 7 physicians speaking, presenting. We did join forces with South Texas Health System. They are offering the CNEs and CMEs. They're going to be getting a total of 8. We do have vendors. All these vendors are all in the healthcare profession, and a lot of them are dealing with the wound products or managements. We have dressings, compressions. We also have a couple of skin graft reps there too. And then this is actually open to nursing students,
Okay.
to nurses, physical therapists. In the state of Texas, physical therapists can actually do wound care.
Wow.
We also have it open to the nurse practitioners, PAs, and physicians. So they do have different charges. And I know for something like this, if you were to drive out of this area for 8 CEUs, they would usually charge about $175 to $200.
Mhm.
Our fees were very reasonable.
Very.
Our students, we were only charging $25. The nurses, $50. Nurse practitioners, PA, $75, and then the physicians, we had it $100 because, like I said, we were offering CNEs and CMEs.
And those
Okay.
are really, really important
Yes, to
for
renew.
people in healthcare to receive and to keep up with.
Yes.
So yes.
So
8 is a lot.
the symposium is from 7 to 5:30.
7. It's well, actually, we start the registration at 7:15. We
Wow.
start the program at 7:45, and we're done by 5. We should be done by 5:30. Attendance will be required in order to get the full CNEs and CMEs. And we are providing breakfast, a continental breakfast, lunch, and then snacks in between.
Okay.
And then we also
That was my next question,
Mhm.
actually. So
Oh,
thank you.
okay. And then we were actually to secure that the attendees do go see the vendors. We will actually have like a Woundopoly board game. Basically, the attendees would go and visit each vendor, get it checked off, then turn that in, and then they would go in for raffle.
Excellent.
So that way, make
Right,
sure that
right.
everybody was spending time with the vendors, because if it wasn't for the vendors, we wouldn't have been
This
able
would
to
not
do
be
it.
possible.
Yes.
Absolutely.
Yes.
Yes. And thank you again to South Texas Health Systems for partnering with us and to offer those CMEs and
CMEs.
CNEs.
Awesome.
We do have a panel of doctors. I don't know if you've got that up there.
I
on the
do have it
screen.
up there, and I was going to ask.
But yeah, so Dr. Ricardo Sobrevilla, Dr. Jose Rodriguez, Dr. Joseph Caparuso, Dr. Pedro Mego, Dr. Pedro Abanto, Dr. Alejandro Rodriguez, and Dr. Maria Aguinaga. So that is a
what's-
fantastic panel.
That is a good panel. I know many of these guys. They've been around for a long time. But what are some of the expertise of each physician that you guys are going to have?
So they're actually out of those 5 of the physicians are board wound care certified and also certified at hyperbarics. They run a lot of the wound care clinics here for multiple different hospital systems. And then we also have a podiatrist there. Dr. Caparuso has been here for many years.
Many years.
And then we also have Dr. Pedro Mego, who's a cardiologist. And
Cardiovascular.
I'm sorry, cardiovascular. And our focus was really approaching the patient at a holistic level, seeing the whole patient, managing the whole patient in order to manage the wound. And a lot of the times they forget that they have to see and manage the whole patient before they manage the hole in the wound. So that makes a big difference.
Yeah, and I'll add that this is an evidence-based.
Evidence-based, everything has to be evidence-based in order to offer the CNEs and CMEs. So anytime they're doing any type of presentations and they have to refer, it has to be logged on there that, okay, this is where they got the data. They can't just go up there and say, okay, well, I'm going to talk about this and this is how I'm going to put peanut butter on this and it's going to heal. No, it's all evidence-based practice.
You know that's funny because you bring up peanut butter. So a story I had one of my Great Danes had babies, and I guess the babies, because of all the sucking they would do on the mom, it created a huge wound.
Mm-hmm.
And so I took her to the vet, and he said, yes, we can do surgery on her if you want, or you could
apply peanut butter.
Tape her up, and I think he said peanut butter, something like that, and actually it worked. So she healed eventually.
Wow.
The puppies, they have their nails, their claws are super, super sharp.
Yes.
You know, so I'm like, wow. So anyway, that was
Well, we
that
can't
was
put
super
peanut butter on a
interesting.
We don't
patient.
use peanut butter.
We
right?
don't, but that was just a
Out of
metaphor.
So Lorena, tell us a little bit about wound care. I know that that from what you mentioned when you were younger, that your mom, I believe, would take sugar packets
Correct.
and then use not alcohol, but
no, iodine.
so how have things changed from back then to today? Because
Drastically.
I think now I hear that there's placental cells that they're using
Yes.
to grow skin. I've researched. Well, I've read articles to where they used to want to use. Because I looked into it a little bit, but doctors back in the day, years back, probably before your mom was using sugar packets, they would use the skin of frogs, the skin of all these animals, but that never really worked. You know,
Right
that
now
never
they're
really- that
actually
never really
using
worked.
fish skin. There's a company that does use the fish also. There's also skin grafts from pigs, porcelain. There's also there's a lot of it has evolved. I know that there's two large wound care symposiums every year. One in the East Coast, and the in the fall they have one in Vegas, and
Mhm.
that's every year. And every time I go, there's something new. There's always a new product that's out coming out, or a new device. I mean, there's you'd be surprised at what you see out there.
Highly innovative.
Wow.
Yes.
Yeah.
Yes.
That
And
is-
the benefit of South Texas is that we have these physicians here. One of the reasons I was really focusing on doing something like this is because I would still, since I travel so much for my work, I would still find patients coming from South Texas to Austin or going to Houston thinking that they can get better care up there, not realizing that we have top doctors here in the Valley.
Yeah, that's another reason for this chamber is that we
Exactly.
want to make this a beacon for the people of our community, a
community.
guiding light, if you will. A lighthouse. It keeps the people. It helps the people find their way, and we
Right.
want to be that
Right.
way. We want you to be able to. Okay, for example, Google. You Google cardiology, you're going to find 50 of them in the area. How do you know which one is the better one? How do you know
Right.
which one would better fit your need, your expectations, so on and so forth. And so we want to be able to be at least a resource to them aside from your Google searching, right? I feel that that's really, really, really important, and
It is.
that's one of the reasons why we started this. There are a lot of back when I needed a specialist, we didn't have a pediatric neurologist that I needed for my daughter. We had to go outside of the valley to seek that type of care. Now we have that. Every hospital system has a different capacity of specialists that are available to the people of our community. You don't have to go away from here. You
You don't.
can seek treatment here. You have cancer centers here that can help you with cancer. You have neurologists. You have
Specialists.
neurosurgeons. You have
Wound care doctors.
wound care doctors, if you will, that are here. And the people's misconception of the Rio Grande Valley is, oh, you have to go elsewhere to seek care. No, you don't.
No.
That used to be the case, but now we have them here. You don't have to go so far. You can get them all here. Tell me which one you need. I'll tell you which one you can go to,
Yeah.
And not only
I mean-
that, we have the medical school here now.
Yes.
They're coming to us
Yes.
to get educated, and then they're going
Yes.
away. We can keep them here. I
Right.
mean, there's a need and there's a demand.
Absolutely.
So, yeah.
I do know that being in the field too for 30 years or so, we are getting a lot of physicians that want more quality in patient care.
Right.
We see that every single day, so in our case, I mean, it keeps us having to stay up to speed with what's
Mhm.
going on.
Keeps us on our
Mhm.
toes
Yeah,
and be
for
held
sure.
accountable for, taking that
And
next step.
that's a great thing because
Yes.
everybody wins.
Yes, it does.
That's right.
Everybody wins. That's very, very
I
cool.
want the people of our community to be able to come to us and say, okay, I need this specific service. Who do we recommend, but who do you have on your membership that maybe we can align with? We can start there. It could be a start. It doesn't have to be that that's the only one that we offer, but join our chamber and then you can be on the list.
Yeah, that's a good idea.
But you
Yeah.
don't have to go outside of the valley.
So going forward, this is your first symposium, and it's going to be specialized in, or the
Our
idea
focus
is
is
the
on
focus
wound
is
care.
wound
Yes.
care.
Okay.
So in the future, are you guys planning on doing this every quarter? Are you guys going to want to be doing this every 6 months,
we've
every
actually
year?
had
What's
an
going on?
amazing response. As a matter of fact, as soon as we closed our event for Eventbrite,
Uh-huh.
we started getting phone calls. Hey, we
Yes.
need this. We need more. Not only nurses, but nurse practitioners, PAs, and physicians have been
Yeah.
calling us.
On-
Hey,
on-
we want to be added on the list. So we're actually going to have to go to the hotel where we're
to the
hosting
venue where
it.
we are hosting this and say, okay, can we add a couple more seats here?
Yes.
Because literally on the way out here, I had a few messages, and there's some doctors that are signing
Interesting.
up tomorrow, and without knowing that we close it today. But we do have some space for them. We did
Okay.
set aside for this
Emergency.
exact purpose.
So.
So the capacity is what, more or less?
So the capacity is 220.
And you're pretty much there.
We're sold out.
Yes, we're
Wow.
closed.
We're
And
closed.
how
It includes the ones that, just in case you're hearing this, guys, you're in.
so it how did you announce it? It's a fairly new chamber. Did you send emails out? Were you calling different people?
So-
Yes,
to,
through our social media platforms, emails. Lorena, again, this is her realm. This is her expertise. So she had a lot of contacts that she knew that would benefit from this. So she did a lot of the communication there. South Texas Health Systems also helped a
Yes.
lot.
And what we did actually is we talked to the doctors. I sat down and I talked to the doctors and I explained to them like, okay, there's a need and there's a demand, and they're like, yes, there is, because we're treating the patients. We want to make sure we're bridging that gap, and the nurses that are receiving these orders or treating managing our patients, we want them to get trained. So they knew there was a need, and a lot of the doctors are like, okay, reach out to this person, reach out to that person. Some of them actually took the lead and said, okay, I already sent these contact information. They already know. It was, I mean, really just getting everybody together, and then that way we can take it. It just took off. And I mean, within, I think we announced within the first 2 or 3 days, I had the commitment from all the doctors. Like the doctors were the first ones that signed up right away. I even have one doctor speaking twice.
And this is volunteer
This is
on their
volunteer.
part. They're volunteering their time to do this for us because they know that this is something that the healthcare community, the professional aspect, right, for the CMEs and CNEs that we're offering, that this is something that is needed for them in order
Right.
to make them and their job successful in treating and caring for their patients that come through their doors.
Yeah. So once we closed down the vendors, I started getting more calls. Hey, I want to sign up also. We want to support you. But we were already at capacity with the vendors. So, and then also with the attending. So we really maxed out everything. Next year,
Wow.
hopefully, we're planning big. We'll
In about
post
6
it.
months or so.
Yeah, we'll
We've
post
got
it
another
on-
one coming out.
Just follow us on the social media
Mhm.
to know. But we're going to take it to the next level. And all these physicians that are also speaking, they're actually members of our chamber too.
Yes.
So
Every
they
one of
all
them.
just
Excellent.
when
So they believe in us.
they do believe in
So
us.
You should too.
So when they made that commitment to present, to speak, they right away said, you know
Yes.
what, we want to be part of your chamber. We want to
Mhm.
make that difference. And it's like I tell them, like, oh, this is a nonprofit. This is volunteer. This is on my own time. This is on your own time. And we are here to make a difference for the patients. And right away they said, yes, we want to be there for you. We want to make a difference in our community because there is a demand. There's a need.
There's a need.
There really is a need. And I know when I got certified, I think there was maybe like 10 nurses for the whole valley, maybe even
Wow.
less. And now I'm hearing there's a lot of nurses that want to get certified. But you need to go through the right channels and get
Exactly.
certified through a board certification program. Don't go through the mom and pops where you think you're going to get the max training. You're not going to get the right training. I know when I went away and I did the math. When I did my certification, it was close to $10,000 because the time off, the time at the hotel, for the certification, and then for the exam. I mean, it was expensive. So that's why when I say for what we're charging for the 8 CNEs and CMEs, that's nothing.
It's not.
It's
Yeah.
nothing.
Really
Yep,
is.
yep. And we have other events that we're going to be announcing soon. We're not ready to announce now, but we want to solidify the dates, but on a smaller scale. But it will still be at a level where we are going to accept a good number of people to attend and benefit
Yeah.
from what we have to offer.
That's amazing. That sounds like something that a lot of people should be involved with. But I think it says a lot about you guys as well to fill it up so fast. But also, it says a lot about the physicians that are participating on their own time without getting paid because they actually care.
They care.
And some of the physicians, I mean, I definitely know myself, and I've had many conversations with some of them, and they're just amazing doctors.
They
You know,
have a wealth
they
of
have a
knowledge.
history.
They have a wealth of knowledge that they're ready to share with everyone who was fortunate enough to get in and get a ticket to attend. So,
Yes, because actually after I closed when we had all the physicians, we had a couple other ones that were,
yeah.
but we were already maxed out. I mean, I didn't have any more hours to put in there.
Mhm.
But yes, hopefully that's what I said. We're making some changes for the next symposium.
Mhm.
Maybe have two rooms going at the same time, and that way I can have two groups of physicians for each room, and the attendee can choose whether they want to listen to this topic or go to this topic. So yes,
That sounds like a conference now, not a symposium, right? So,
Yeah, pretty much.
pretty much.
Okay, that's dream big.
yeah,
Yeah.
that's really cool. So the next
We're not-
symposium, I know you don't want to mention it yet, but when do you think it's going to be?
They're
gonna
lower
come
scale, so
around?
probably November. We're looking at
November.
November at our next one, and not.
Oh, so this is
We're moving
yeah.
fast.
We're
Yeah.
moving fast.
Yeah.
Yeah,
I think-
Maritza already
I
started.
think someone said you're moving a little too fast. I said, well, I mean, can't sit back and wait. I mean, there's so much to cover. There's so many things that we want to share with the community. I mean, you just got to move.
Mhm.
Again, this is not even our real job.
Right.
This is our
something
volunteer
we
on
just
our own
have
time.
a passion for our own time, our own monies went into this. Setting this up. So, yeah, we're making it work.
So okay, so can you're going to have physicians there? You have a lot of other people in the healthcare field that are also going to be there. But what about people that are not in the healthcare field?
For this particular event,
Right.
we don't have any because we're offering the CMEs and the CNEs.
Okay.
These are the credits. But our November event will not be one that requires people that have that are physicians or nurse practitioners. So this will be open to the community. It'll be open to people in that field of work that
Mhm.
want to learn more, want to know more. So yeah.
Wow, that's awesome.
And we
That's-
plan to do more community events, like
Of
like we
course.
said, going forward. Like one of them is Walk with the Doc.
Right. And then we have, our monthly lunch and learns. We want the people in the community to come in and listen to, free advice from a physician in a specific specialty that interests them. They're welcome to attend and sit there and have a little lunch and listen to the doctor's advice, and a little Q&A. Yeah.
So how would the walk with the doc? How would that work? What would that entail?
Well, that would entail physicians who want to participate in this will be able to address the community with a specific health topic, kind of, a friendly camaraderie style event, not so formal. It's not a 5K run or anything like
Yeah,
that.
I was gonna say,
No.
how do
Like,
I
how's that
actually-
done? No,
Yeah.
you get to mix and mingle with them for a little bit, then you go for a walk.
Mm,
It's not anything,
Get your
Fancy.
blood flowing.
yeah,
Very, very cool.
health topics.
Very, very cool. I don't know if you'd have to get maybe some cardiology type physicians there because I don't know,
Yeah.
just because of the walking itself.
Right.
Oh,
Cardiology, cardiovascular, any walking is good for you. Walking is the best medicine.
Yes.
Walking and eating healthy. I mean,
Of
I'm not a
course.
doctor, but that's what I hear. I sit in so many physician meetings, and I hear the conversations, and they're pretty interesting. Yeah.
So with the article in Concepto, what was how did that come up? How did that come about? Is it we have it here. Can I see that please? We was it more of an advertising that you guys were doing? Did they do a little story on you
Yes.
guys,
So it was a
or-
little advertising, kind of,
Okay.
Who
Um,
we are.
showing who we are, what we're about, what our driving force behind this, what it was. So it just kind of shows. It talks a little bit about both of us in there, and then it kind of shows a little bit of past events that we had when we first started. Some ribbon cuttings, because we do ribbon cuttings, we do milestone celebrations, inaugurations, whatever you want to call them. It's tailored to your need.
It's basically putting a name to a face.
Right.
It's
Hmm?
a name to a face.
A name to a face. Yes.
So are you guys doing anything? I again, I know it's in your chamber, but it's October,
Mhm.
so it's Breast Cancer Awareness Month.
We volunteer.
So, is there anything
We
that
don't
you guys are doing
have
currently,
anything
or
planned for this month per se, but we did volunteer at
Yep.
the 5K run and walk with Texas Oncology. So we did
That was this
volunteer our
weekend?
time.
I saw-
Yes,
I
that was
saw you guys
this
there, yeah.
weekend. We volunteered our time.
Who
And
they
we were-
happen to be members also.
and they are members.
So we were there supporting our
we're
members.
supporting them. Yeah.
Yes.
excellent? I know that because I've been putting up on the screen. The Mission Pink is gonna happen. When is gonna happen, guys? It's gonna happen October the 11th. Um, because of course we want to get everybody that needs a mammo, or at least bring awareness to that.
That's right.
Which I'm a big
Supporter of.
supporter
Yes,
of. Yeah,
yes.
for sure.
That,
Because
for
I
sure.
have a lot of history there.
Exactly.
And yeah. By the way, we have 3 clinics, 3 imaging centers that do 3D mammography.
Are you doing something for the community, Israel?
Yes, for anything related to this topic
Yeah,
specifically, absolutely.
we're doing a lot
Yes.
of stuff, and we participated also in this the cancer
Yes.
center.
I saw you there.
Um,
And I chime in a little here and there because I'm fortunate enough to be a contract with Texas Healthcare Imaging.
yeah,
So
I mean, we just have to bring awareness to everyone.
absolutely.
You know, and we deal with it daily. We know that sometimes transportation is an issue. Sometimes a lot of these insurance plans, they have there's metrics that the doctors not the doctors need to meet, but they want their patients to meet, basically.
Right.
Because again, you know, early detection is the best.
It's best prevention.
Yeah, the best prevention. You know, so I think that's important that we get that early, we catch it early, and not just with breast cancer, but with so many
All the
so
diseases
so
out
many
there.
other diseases out there.
Mm-hmm.
So what's next with the chamber? What are you guys looking at doing here in the near future? You have a symposium potentially again in October.
No, not in October.
I mean, not in October.
November.
Well,
What-
October is
November, I'm so
our
sorry.
our symposium.
Yes.
So that is this month. We are
Yes.
October today.
Yeah. Wow.
So
Time
this
flies.
month.
It goes by
next
quick.
week, actually, next week.
November we have.
But November we
planning.
do have one that we'll probably announce that maybe Monday.
Okay.
Make it public.
Yes. And then the attendees will be the first ones to hear about it because
Yes.
we are going to be talking about that. And then we also are working on doing some kind of event just for our board members. So that way, because we're planning for 2026, so we're probably going to get the board members to all get together so we can start planning for next year. And our goal is to have our calendars out, at least by December for the first 3 months or first quarter, so that way everybody can plan as to what's
Right.
coming up.
Yeah, and that'll be on
Okay.
our
Webpage.
website.
Okay.
Yes.
And the website again is
www.texashealthcarealliancecc.org.
okay. Is that up or is it almost up?
That's up. That's
That's
up
up.
today.
It's up as of
We
today.
went
Yes.
live today.
Yeah, we went live with
Awesome.
it today. It took a while for us to get it out, but we got it. I do want to mention some of our board members.
Yes, I was
That's
gonna
okay.
ask. Yeah,
So
for sure.
Dr. Joel
Yes.
Solis, Dr. Pedro Mego, Dr. Rodrigo Arginal, Dr. Elizabeth Adamson, Dr. Andrea Burciaga, Dr. Nina Enriquez, Marla Sandoval, Tom Castaneda, Elias Arginal, Zeke Moya, Mario Liscano, Yolanda Guzman, and James Olivares,
Olivares.
pharmacist.
So you have a lot of physicians there that have tons of experience, and you have a couple of representatives from other hospitals
Yes.
as well.
Yes.
Different
So
hospital
that's
systems.
very
Yes,
good.
Yes,
Yeah.
yes. I thought,
That's really good.
and they said yes. We approached them with this. We invited them to be a part of this, and they said yes. And thank you guys. It means a whole
It
lot.
does.
We really appreciate you. We appreciate your guidance.
We do.
Good,
do.
good. Anything else that you guys want to mention right now?
No, I think we're good.
You're
No.
good?
Yeah.
So guys, if you guys, I guess on our, we'll have the link up to the website. We can put that here shortly. you guys have the information on the chamber, and again, it's called the Texas
Healthcare
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 Alliance.
Alliance
Chamber of Commerce.
Commerce. And for short, it's, did you shorten it?
THACC.
THACC.
And our office is in McAllen.
Is
Oh,
our office
yes.
is
Where's
located
your
at
office?
621 North McAllen Suite A.
621 North
McAllen. North 10th.
McAllen.
North
I mean, I'm not 10th. I'm sorry.
620, it's
Got ahead of myself.
621 North
I read so
10th
fast.
Street, Suite A.
Suite A.
Yes,
621 North 10th.
Suite A.
All right, very, very cool. So, Lorena, where are you going next? What's your next trip?
My next trip is Omaha, Nebraska.
Wow, and again, you're gonna be
Gone for a whole
speaking. You're gonna be
Training.
training.
Yes.
Again,
Yes, and so
specifically wound care.
Tomorrow she
Yes.
goes to buy a Samsonite suitcase over at the outlet malls, big enough to fit me in it.
Oh, yes. Yeah, you do travel a lot.
Yeah, that's
Yeah.
already twice I asked, right, for her to take me
Yeah.
on a trip.
Yeah.
Waiting for her to say
I haven't
yes.
seen her agree.
She's like, Marisa, I'm going there to learn.
To work. To work.
To
When yes. When I do training on the hospital, sometimes it's day shift and night shift. So I have to be there day shift and night shift.
And you train all types of people. You train
Yes, nurses, physicians. We work with nurse practitioners. So it's on the products that we carry. So yeah. So it's
Wow.
just getting out there in front of the customer, and start working.
such a big need for all that stuff.
Oh, yes.
there is, and you just. I mean, I always try to remember where I came from because I don't know everything, and I put myself in their shoes too, and just be patient. Just take them one step at a time.
A lot of these skin grafts or a lot of these patients that have issues. I mean, it's not something that gets fixed
It isn't
from one day to the next, really, right?
No, and I've had it in my family. My mother had a chronic wound. My brother has had issues too, and it's just it's very difficult to heal sometimes because sometimes the patient maybe doesn't see well, that can't do the wound care by themselves. So there's a lot of factors that play into chronic wounds that don't heal. So, and we have to start home, and I believe that starting in the community, that's going to make a difference.
Bringing awareness.
Bringing awareness, and whether it's on wound care this month, next month, it could be, hospice information. The following month, it could be, PAD disease. It could be any type of disease, and that's what we're going to focus in, just bringing awareness and education, not only to the physicians and nurses, but also to our community, meaning that patient.
Yeah.
So,
Love it. Love it.
yeah.
Love it. Love it. Okay, folks. So you guys know where you can reach these guys.
I can give our number as well if you like.
Yeah. What is that?
956-530-2080.
Say it one more time.
956-530-2080.
And who is that? Is that an office? Is that your cell personal?
That's
or?
a cellular phone to our chamber,
Yes.
Okay.
specifically for that.
Very, very, very good. Lorena and Marisa, thank you so much
Well, thank you
for having
joining
us.
us today. Oh, one thing we didn't mention is you guys are thinking of starting your own podcast or to again just bring awareness
Absolutely.
to the community.
Absolutely. Inviting, the people that are members have
So-
an
so-
opportunity to.
Some of the physicians
Yes.
you're mentioning, right?
Yes. Anybody who's a member, we
Yes.
even have nonprofits that are members. The
Right.
Alzheimer's Association,
RGB.
we'd like to invite them
Diabetes.
to come by and talk about their service. Again, if they're members, we offer that opportunity.
Right.
Excellent.
Mm-hmm.
So, but the podcast itself that you guys are planning on doing, that is something that might happen in the near future.
Oh, very, very near.
Very
Of
near.
course, we here at Agave Studios, we offer some of this equipment for the use of
And it'll be here.
everyone and anyone. We just say respect the home. That's about it. But other than that, yeah, no, I can imagine, and I know there are some shows out there, some podcasts that have medical experts on there, And depending on how often you do it, you're going to reach a big, big,
And
big.
we'll be bringing that. That is our whole idea. Our mission is to be able to do that. We want the people in our community to know that we have experts in different fields available here to them in the Rio Grande Valley.
We really do.
Mhm.
With the UTRGV, um,
Oh, that's a
again,
game changer right there.
it's really changed everything
It has.
for us here in the valley.
Mhm.
There's so many things that have happened. I mean, just in the last 5 years, that are really helping people live a longer life, and the quality of life
Quality
itself
of life.
Right.
Yes.
is just something that people like you guys, with what you're doing, you're changing,
Making a difference.
making a big difference.
That's what it's all about.
Yeah.
That's what we want.
Yeah. And that's one of the things we want to do here on this show, is just make some sort of difference, bring some education, bring some knowledge to the folks, and thank you guys for being here.
Thank you for
Thank
having
you.
us.
And hopefully we can do it again, and
Oh,
maybe
yes. We will
help,
be here again.
help your podcast,
Yes.
get an audience, and tell the community about what things you guys, what positive things you guys are doing for them.
Absolutely.
Thank you.
So again, thank you guys very much. Folks, again, this is another show that we just finished, so we appreciate you guys chiming in. You'll see it on Facebook, Instagram, YouTube, and again, please subscribe, like, share.
And
That
follow.
way we can, grow the audience, and just reach out to as many people as we can. So again, thank you guys for joining us, and
Thank
you.
folks that you guys are seeing out there. We appreciate you guys. We appreciate you guys being on here as well. Take
Thank
it easy.
you.
Have a good
Yes.
night, guys.
Thank
Good
you.
night.